Greetings to all viewers. This is Dr. Shobna Mohandas from Sun Medical Center, Thrissur, Kerala. I would like to speak on an important subject which is talked about very frequently these days. That is fibroid uterus, which is very common in every place. And we were so far every time when a patient used to come and ask me, doctor, is there something we can do about it? Why did it come to me? What did I do that I got it? I had really no answer except saying that people who deliver frequently don't get fibroids and things like that. But over the years, there is a lot of data coming in about the diet and fibroids. But there is a disclaimer from the beginning that symptomatic fibroids will not shrink with diet. The patient has got pain, she's got bleeding, if she's got dysmenorrhea or urinary problems or back pain, and she is really in misery, then the fibroids will have to be removed, whether it is laparoscopically, whether it is hysteroscopically, or temporarily with medicines or uterine artery embolization, whatever it is, they require intervention. Only those who have fibroids, and those is a very big number, 37 to 53% is a prevalence of fibroids. If they by mistake on scan they find they have got fibroids which are not harming them in any way, then to prevent growth, or people who have already undergone surgery, they want to prevent it from coming. So that is their questions that the patients normally ask. Can I prevent it from growing, and can I prevent more from coming? Here is the role of diet, and here is what is going to be said matter. Yes, fibroids are estrogen dependent tumors. Estrogens are hormones coming from the ovaries, and more the estrogen, more the fibroids you'll have. And the amount of estrogen can be decreased with a huge amount of fruits and vegetables. When they did research on a group of women who have been taking fruits and vegetables, and another group who have undergone surgery for fibroids, they found that the women who have not undergone surgery were actually being taking a lot of fruits and vegetables. Now, they say that 4 servings of fruits are necessary. Now, we should know what is 1 serving to know what is 4. 1 apple, 1 banana, 1 pear, or 1 cup of fruits, or 4, all that can constitute 1 serving of fruit. And 4 servings of fruits can actually reduce fibroid size even without medicines, only diet by 10%. But even that 10% is important. If you take a lot of fruits, it's a good thing if you can reduce the size by 10%. What about vegetables? What is 1 portion? That is 1 large carrot or 1 handful of carrots, 1 handful of a small tomato, 1 handful of beans, 1 handful of red capsicum, broccoli 1 handful, or 1 cup of raw vegetables. Now, 1 cup of salad leaves which are edible, like, lettuce leaves or dark cabbage or something like that, which can be actually eaten raw. So all this constitute 1 portion. So either fruits or vegetables, if you can really take 4 portions, you can reduce the size of fibroids. If you can take even less, at least the fibroids can be stopped from growing and or prevented from coming. So basically, a lot of vegetables and fruits are good for reducing or stopping fibroids. What can you, what else? Yogurt is supposed to be good, and in India, curd is good enough. Why? Curds, it has got a lot of bacteria, and bacteria can, from the intestine, can go to the uterus and prevent the growth of fibroids. So if you eat a lot of these things, what can you avoid? Anything with trans fatty acids like, non-khattais or biscuits, or your foodies like French fries or fried things, all that can be avoided. And whenever there is a hunger pang while sitting at the computer or for studying for entrance exam or something sedentary where you are stressed out, go out and look for your vegetables and fruits instead of looking out for fried items. That can help. Now, while using oils, the Polyunsaturated fatty acids, which are good for many other things, are bad for fibroids. And the oils, that is sunflower oil, is bad. And coconut oil, which is poor in PUFA, is actually good. Now, curcumin is a very common ingredient in Indian food. 1 spoon of curcumin in milk boiled can be taken, or a lot of curcumin. Normally in Indian diet, curcumin is added to the bhaji and everybody eats it. But instead, singly that person who's got fibroid can take little more curcumin in the diet. The fibroids can actually reduce or not come or not grow. Another molecule is quercetin, which is very abundantly available in cauliflower, broccoli, and cabbages. And whenever you take vegetables, you boil these vegetables and make that as one portion, that can be even more helpful. Lycopene is also anti-fibroid, and anything that is red, like tomato, pink guava, papaya, capsicum, the red ones, watermelon, all this can be the chosen vegetables while you take four servings of fruit. Resorcinol is abundant in grapes, strawberries, dark chocolate, and these days blueberries are also available in India. So these are all rich sources of resveratrol, which if found in abundance can reduce or prevent fibroids from coming. Green tea is a favorite for many illnesses, and if taken abundantly can reduce fibroid as well. Magnesium rich diet is supposed to be helpful, and what the vegetables which have magnesium are pumpkin, spinach, almonds, cashews, peanuts, your chickpeas, or black beans, or all these have magnesium, and taking that in abundance can reduce or prevent fibroids. Red meat is a no-no for fibroids. That is meat coming from pork, sheep, cow, buffalo can be avoided, or at the most you can take it at 75 grams per day or 170 gram per week. So that not going above that can be helpful. Whenever you make the meat, remove the fat and take only lean cuts while making the preparation. Chicken, again, not more than 150 gram. If possible, avoid. While making chicken, remove the fat. So all these things are not good for the fibroid. Now, certain oils which are not good for fibroids are PUFAs, polyunsaturated fatty acids, which is abundant in certain fish like salmon, mackerel, sardines, herring fish, and certain fish which are less in that is your shrimp, scallops, or codfish or lobster. So substitute the cheaper fishes as maybe the costlier ones, or take less of the fish which have got so much of oil in it, or don't combine the fish and the meat and the chicken and everything on one day. Take everything in moderation. All this can help in the prevention of a fibroid growth or prevention of it coming back again. So in short, increase fruits and vegetables, include special condiments like curcumin, reduce red meat, oily fishes, and fatty fishes, and all that can help in prevention or stopping the growth of fibroids. Thank you, and I hope you had a good knowledge from this particular video, and thank you all for a patient listen.